I'm talking to Steve Balogh, and he's the research scientist for Met Council Environmental Services Division. And Steve, you have a key role in monitoring and sampling wastewater which is actually sewage. And what you're looking for is the virus that causes COVID-19. Why wastewater?
Well, wastewater is a sample of the entire community's discharge, basically, so we can see anybody who's infected with COVID-19 in the metro area, basically in the metro plant service area, when they're sick, whether they're symptomatic or not, whether they've been tested or not, their discharge will show up at the wastewater treatment plant. So it's a measure of the prevalence of the virus in the community.
You mentioned the Metro plant, and that's where you take your samples from. Can you describe the size and scope of the Metro plant in St. Paul?
We treat wastewater for approximately 2 million people in the metro area. There's 66 communities that contribute their wastewater to the plant, and 2 of them are Minneapolis and St. Paul. And we're located on the south end of downtown St. Paul, right along the Mississippi River. We treat wastewater about 180 million gallons per day on average. Originally, wastewater treatment was designed to protect public health, to get wastewater and pathogens and viruses out of the community and take care of them in a safe way. And we've really gotten back to that with this work, because now it's very clear that wastewater treatment has a public health aspect and a public health protection aspect, in the sense that we can see things even before they show up in clinical testing.
Can you talk about the prevalence of the virus that you're finding?
Yeah, right now we are seeing very low levels. Since the Omicron wave in January decreased, we're down probably 98% from the peak. But recently we've seen a changeover from the BA1 Omicron subvariant to the BA2 subvariant. And now BA2 is actually increasing again, and it's causing the total amount of viral RNA coming into the Metro plant to actually increase. It's not increasing rapidly, it's not increasing a lot yet, but it is increasing now, where we had been seeing only decreases for about 2 months.
So if folks are looking at our data online, where we update this every week, every Friday, what would you say are the key messages or the key takeaways from the data that they would see today?
The message is to remain vigilant and remain careful, but recognize that levels are low but increasing.